It's time for Studio 7, sponsored by your Permian Basin Chevy dealers.
It's the art of dentistry. Dr. Robin Rutherford.
Welcome back. Do you have a tooth implant? Or are you in need of one? Dr. Robin Rutherford is here to explain how routine implants work. Dr. Rutherford, thanks so much for being with us.
I always enjoy it.
Okay, so let's talk about implants. What are they?
Okay, I've actually spoken about implants multiple times on this show. Sometimes we have a couple of implants under a denture just to hold the denture down, to give it something to grip onto, which solves the biggest problem of dentures, is that they're floppy. Well, I wanted to go back and just talk about just the basic scenario, like you are missing a tooth, or you're going to be missing a tooth. For example, you know, you have some sort of a disaster that happened to this tooth or that, and you're going to lose that tooth and you want to replace it, which you should do. Okay, so here's photos and models. Actually, I don't have patient photos so much on this one, but on this first picture you can see, okay, here's a model of a missing tooth. Now, here's what's under the surface. People think of your tooth as being just the part above the surface. That's like thinking a tree is only the branches and the trunk, and they say there's as much root surface and everything under the surface as there is above. Okay, well, with a tooth, you have the top part of the tooth and the roots under the surface.
Okay.
Well, this shows a picture how an implant is kind of like a post. It's metal, it's titanium, which, by the way, is a metal that is called biocompatible, but your body likes titanium for some reason. So it does not ever reject titanium.
Okay.
New hips, shoulders, knees, things like that are made out of titanium. But anyway, implants are made of titanium, and we place that in, I place that in, and it's like the root of a tooth. So it's in the gums and in the bone under the surface. So we place the implant, and actually you have to give it about 3 months for the bone just to kind of grow to the surface of the implant and grip onto it. It's kind of like if you put a fence post in some concrete, you have to come back tomorrow when the concrete is set. Well, in the case of implants, you have to give it 3 months. And it used to be longer. It used to be 6 months, 5 months, 4 months. Nowadays it's 3 months. So, you know, improvement is happening.
Yeah, that's awesome.
But then we come back, and after the 3 months happens, oh, and here's an x-ray just showing exactly what I was describing in between a couple of real teeth. But then we put the crown on. So once the crown is on, and you look at it from your smile, it looks exactly like a real natural tooth. So yeah, you can't tell at all.
Okay, so very painful process, this?
Not at all. First of all, it doesn't take very long. I've placed implants in as little as 9 minutes if everything went just right. Maybe 30 minutes if it was more complicated.
Right.
It's a little sore. In fact, you know, almost any time you're having an implant placed, it's a place where you have lost a tooth. And so people routinely tell me, you know, it wasn't as sore as when they pulled the tooth. So that kind of gives you something you can relate to.
Wow.
If you take a tooth out, it's probably going to be sore some for a couple of days. Well, when we place an implant, really taking a tooth out is kind of savage. It's kind of like, you know, I just tore your arm off your body.
Yes.
You know, taking a tooth out is kind of savage. This is really precise and on purpose. We make the little hole, the little post hole. My mom and dad were farm and ranch, so post hole. And then you place the post, the titanium implant there, and then you just sort of let it cover up and let it be there for 3 months. And so it's a little sore for a day or two, something like that. You know, people tell me, yeah, I took 1 pill, but that's about all.
Right.
You know.
But we talked about in the past that you want to do everything you can to not lose your tooth, but if you do lose it, you need to get something like this done, right?
Right.
Okay.
Right. One of the big advantages of having an implant is when you lose a tooth and the bone no longer is needed to support a tooth right there, your body will let the bone just shrink away. And you'll end up with a gap there.
Oh, okay.
It's kind of like it's just shrinks. Now you don't give me the bone that I need to place an implant. So ideally, if you take a tooth out, that's the best time to place the implant.
Okay, all at
because we
once.
still have the bone. Sometimes we can graft bone back and rebuild what we want to be there. You know, it's like planting flowers, making sure there's good topsoil there so the flowers are going to do great. So anyway, placing the implant is actually easy. Doesn't take very long. Doesn't hurt, basically. You can do it with sedation if you like. You can not have to be there, you know, and it's only going to take us not very long anyway. Awesome. So yeah, it's really a good deal nowadays to have that.
Easy process. All right. Well, thank you so much for being with us.
I love it. I enjoy what I do.
It's the art of dentistry.